Hello, everyone. Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna, British Columbia. And today's topic is it okay to crack your own back? We want to talk about back cracking and whether or not it's okay for you to do it yourself. And we're going to get into the details of it because it's a common question I get, as well as a very popular topic on social media. So who am I? My name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, British Columbia. I have over 25 years of experience being a chiropractor. I've seen over 10,000 patients, and I've done over 100,000 adjustments in the clinic to all areas of the spine, to different joints like the shoulder, the knees, even the jaw, the TMJ. So a variety of experience doing adjustments to the body and to the spine. So is it okay to crack my back? Well, you see these videos on social media, you see these self-help videos. It does feel good for a while, like 20 minutes, and then it feels like that effect wears off. But what's really happening when you crack your own back? And then the questions are, can I hurt my back? Why does it feel like it needs to even crack? And can it help me if I do that? And what's that noise? And why do I feel relief? So there's a lot of questions surrounding cracking your back. So can you hurt your back? I guess the short answer is yes. If it's done incorrectly, if you crack your back, you could hurt it, and you could sprain it or strain it. Often when people crack their back, it's the loose segments that are cracking the easiest. So it's the hypermobile segments that are cracking easily. And the ones that are really stiff that really need help, like a chiropractor to adjust or to crack, are the ones that aren't moving. So when you do it, it kind of perpetuates the problem. It makes it worse, and it kind of reinforces the imbalance where there's tight segments and loose segments, but the loose segments are the ones that are cracking when you do it because it's so easy to just twist a little farther and then get those cracks. So there's the two things there. There's the if it's done the wrong way, you could sprain it. And secondly, there's the reinforcement of the bad pattern, the imbalance. The bones in the spine lay on top of each other. So there's one stacked on the other. And there's two joints in the back part of the spine called the facet joints. And there's the one joint in the front called the disc that joins the bones together. If you push down incorrectly on the spine, like people say, oh, my friend walked on my back, you can jam the joints together. And if you jam them together, you could damage the tissues in the joint. You could damage the cartilage. You could damage the bone. You can displace the ligament and stretch the ligament too far. So you could sprain it. So there's a number of things you could do by incorrectly putting force on the spine. Too much force can hurt the person. So if you do that too much force, you can get hurt that way. And if there's an underlying condition, let's say the person has osteoporosis, and you do that to them, you can actually cause something like a fracture or stress fracture to the spine. So you really need to understand the underlying condition to be able to do an adjustment effectively. Why does it feel like your back needs to crack? Well, there's tension in the joints. And often when the spine is out of alignment or it's not working right, these misalignments can cause stiffness. The muscles around the joint start to, some of them tighten, others loosen to adapt to the bone being out of place. And you can get tension around the segment as a protective mechanism to prevent further injury. So basically it's stiff and it's tight and it feels like it needs to crack. There's nerve receptors in the joint, and sometimes these nerve receptors are activated or firing, and you get a signal to the brain saying, oh, it's painful here, there's a problem here, and you have to pay attention to me. So basically, your brain is focused on that area because of these nerve endings or nerve receptors called mechanoreceptors and nociceptors in the joint. There can be achy muscles and ligaments. There could be inflammation in that area due to the sprain or strain or imbalance. So these achy muscles and ligaments feel like they need to get stretched. And by cracking your back, it can feel like you're stretching out those ligaments and those muscles. So can cracking the spine help it? Well, yes, if it's done correctly. And what it does is it restores the alignment of the back. It restores the function of the back. So it increases the range of motion and it restores the function. It improves the nerve and the blood flow. And it also releases the tension in the area so that the area can heal properly. So adjustments can be very beneficial to restoring the health of that area. Adjustments, though, cracking the back needs to be done by a professional. The reason chiropractors go to school for so long, and in my case, the professional experience I have helps me to make good decisions on how to do the adjustments and when to do them and how to make them most effective. So it does take a lot of knowledge and it does take a lot of experience to do it properly. And what's important is to understand the condition, the underlying condition, the person's history, their anatomy, the physiology of how the body works. And then proper follow-up is important. So it's not as simple as just cracking the back and then that's it. It's important to follow up. It may need some further treatment. It may need some reconditioning of that area. It may need some stretches and exercises. It may need some lifestyle changes to support that. What's the noise when your back gets cracked? Well, the gas changes in the joint. So basically, there are some changes to the gases in the joints. There's some nitrogen gas in there. There's some carbon dioxide. So there's different types of gases that are in the joint. And when we do the adjustment, it causes cavitation. So cavitation is something where the volume of the joint changes and then you get a pressure release. You can't do it again for 15 minutes because the gases change, but the endorphins get released in the area and these endorphins make that area feel better. So it actually feels pretty good when you get an adjustment. So with these endorphins released, they're made in the pituitary gland and they affect the pain receptors in the area. You feel a sense of relief and less tension and you just feel better. So that's why chiropractic care and chiropractic adjustments are so effective. If done correctly, they can really help the person to feel better and to function properly and have a better lifestyle. So we can restore health by doing these chiropractic adjustments. So in summary, don't crack your own back. If you don't know what you're doing, you can perpetuate the problem. You can hurt yourself or someone else and make the condition worse. It needs to be done by a professional who understands the condition and has training, not just textbook training or knowledge, but also the way to apply it, has some experience and knows what they're doing. Chiropractic and adjustments are effective for pain relief, restoring function, and alignment. If you want to follow me on social media, I'm at Dr. Cary Yurkiw on Instagram, Facebook, and Twitter. I do have a podcast called Super Healthy, so follow that podcast. It's on Apple and Android, so please follow us on those social media channels. Also on Eventbrite, you'll find my channel Yurkiw Chiropractic, where there's more free webinars like this one. There'll be some paid webinars, and then there'll be some paid workshops as well, so that you can do certain things to help yourself. And for new patients, we are accepting new patients at the clinic in Kelowna. So you can book by clicking on the link below in the show notes. And I'll put a link to the Eventbrite page as well. I'll try my best to put some links to social media as well. And that way you can follow us and you can see what the upcoming events are and you can book an appointment if you want to come into the clinic. want to thank you for joining me today.